check fasting insulin in my patients. Here's why most oncologists don't and why they should. Insulin is a growth hormone. Its job is to signal cells to take up glucose and grow. That's normal and necessary. But when insulin is chronically elevated, as it is in insulin resistance, it doesn't just signal normal cells, it signals cancer cells too. Insulin and its related growth factor, known as insulin-like growth factor or IGF-1, bind to receptors on cancer cells and promote their proliferation. Multiple studies have linked elevated fasting insulin and insulin resistance to increased risk of breast, colon, pancreatic, and endometrial cancer specifically. Here's what makes this particularly important. Insulin resistance is largely silent. You can have significantly elevated fasting insulin for years with no symptoms and no diagnosis of diabetes. This is why I believe in checking fasting insulin, not just fasting glucose, fasting insulin. The two sometimes tell very different stories. So what drives insulin resistance? Refined carbohydrates, sedentary behavior, chronic stress, poor sleep, being overweight or obese, all of these create a hormonal environment that is measurably more favorable for cancer growth. Addressing insulin resistance is not just metabolic medicine, it's also cancer prevention. And this is partly why the diabetes drug metformin has documented anti-cancer activity. It's also why I predict we'll be hearing a lot more about GLP-1 drugs and their role in cancer prevention as well as cancer treatment in the future.